Okay, and by the way, this is the last weekend of fall, of summer.
Oh, right, because fall rolls around next week, huh?
Yeah.
Well, although it doesn't really feel like fall yet here.
Well, what are you waiting for? The trees, the maple leaves to fall off the trees?
I need a pumpkin like candle burning in my house, and then maybe it'll feel like that. The smell of it.
You sound like Beth now. She does.
I know I do. All right. Well, this is kind of an embarrassing topic, but it's getting a lot of attention lately. Nobody wants to talk about it, so we're going to talk about it this morning because we're not embarrassed, right, Kristen?
No. You won't even mention what it is. You're making Kristen talk about it.
No shame to our game, huh? We will talk about it because when you gotta go, you gotta go. Regardless of whether there's a bathroom around. It's a problem many women have, especially if you had a baby. And guess what, ladies? It's okay. And you're not alone. Check it out. Ever happened to you where you just can't make it to the ladies' room? It's not just a problem for the 60-plus crowd. Do these look like senior citizens to you?
It's time to bring it out in the open.
Drop Your Pants for Underwearness, a campaign by Depends that's drawing a lot of attention to a topic that's typically hush-hush.
Bladder leakage, or also called bladder incontinence, is when you involuntarily leak urine. So essentially, you're hanging out, and then all of a sudden you feel urine where there shouldn't be urine. And that is a major problem. It's something that most people don't talk about. This is pretty embarrassing.
And when you gotta go, you gotta go. It's an issue that doesn't discriminate.
It's very common. You know, it can affect even up to 1 in 5 Americans, and it actually depends kind of on what age group you're in. But it's fair to say that I would bet that you know somebody who has urinary leakage. It's just they're not going to tell you about it.
Experts say when you have a baby, moms, there could be a leakage issue to follow. If you haven't had a little one, maybe your parents are to blame. Dr. Hong says genetics can play a role. Or it could be your lunch.
Acidic foods, spicy foods, alcohol, even the amount of fluid that you're drinking, those are all factors that we have to consider when we work up incontinence.
And though panty liners and other feminine products, and there are a lot of them to choose from, may be a quick fix, there are other ways to take control.
Prevention, of course, in incontinence means that you can do some exercises to try to strengthen your pelvic floor. These exercises are called Kegel exercises. And in fact, I'm doing them right now. They're actually quite easy to do.
There are also medicines out there to help, and in extreme cases, surgery to correct incontinence.
Leakage happens. Leakage happens even at a younger age, but we can do something about it. And you don't have to live in embarrassment, and you don't have to live in fear.
Okay, so I have something to show you now. It's called Go Girl, and if you have to go to the bathroom and you're like in a place like the car or somewhere where you can't go to the bathroom, someone dropped this off at the station. The catchphrase is "Don't take life sitting down." It allows women the convenience of standing when you urinate, and I told you there's no shame to our game, right? Yeah, this is a legitimate product on the market, so we figured we'd show you. You take this out, it comes in a little package. Like, look, it's like this big. This fits in your purse or whatever. Yeah. Even
and
your
it's
pocket,
reusable.
your smartphone, and your Go Girl. You know?
Well, is that available like a Walgreens? Just go up there and say, I'm looking for
you can get it on their website.
Oh.
And I don't need to show you. I'm sorry.
No, don't laugh. You're making fun of a serious situation.
No, I'm not laughing.
I'm laughing because Corey came out and was like, what the heck are you guys talking about?
Can I clarify? Is this for women who want to pee standing up?
This is
right.
for women. Yeah.
Well, where you don't have a bathroom.
Is there anything left for men anymore?
I mean, it's kind of...
that's the one thing you had over us, huh?
Go back to them.
Guess what, buddy? Not anymore.
I gotta admit that one time I did wear Depends when I was training for the half marathon. And I didn't want to stop and go to the bathroom to improve my time.
But isn't that hard?
Do you know how hard it is to do that when you're running?
Yeah.
And then when I ran, everybody just did it on the street anyway.
So you're hustling in with your big Depends on and trying, and these people on the side of the road.
And once you do in the Depends,
it's like, I know, I have kids. I mean, I get it. They expand. It has to go somewhere. It's not going to run down your leg or it won't work.
Yeah, it's like wearing a diaper.
Yeah. I mean,
it is a diaper. All right, now that we've talked about all these personal things.
Yeah,